So today what we'd like to talk about is what the entourage effect is, what are cannabinoids, what cannabinoids do, the endocannabinoid system, the naturally occurring cannabinoids that you can find in cannabis and in our bodies, as well as Q&A with the presenters. So that being the case, let's first of all frame what cannabis is. Michael, cannabis has three main components. Can you tell me what those are?
Those are going to be your cannabinoids, which are going to be your molecules that stimulate the cannabinoid receptors of the body and brain. Produces 80 plus cannabinoids, including your CBD and THC. You have your terpenes, which are organic hydrocarbons that give cannabis strain its aroma and taste and can add to compounding effects. And then you have your flavonoids. And these are the compounds that contribute to the color, aroma, and taste of individual cannabis cultivars or your strains.
And those work together. Amy, working together, they produce the entourage effect. Can you tell me a little bit about that?
Yeah, most certainly. So the entourage effect is how all of these different compounds in the cannabis plant work together. And what we have always really found is that when you have cannabinoids, terpenes, and flavonoids working together, you get something called the entourage effect. I know you like to say 1 + 1 = 3. It's just they're more effective together. That's the best way to put it.
Yeah, they work better together than they work individually. But also, let's talk a little about what cannabinoids are, because there's a lot of people who refer to them. Interestingly enough, cannabinoids were first discovered in 1896. Some research that was done, released in the Chemical Society transcripts, came out and said they found some active substances in the resin hemp of Indian hemp, and they actually named it at that point cannabinol. CBN. And that CBN structure was actually then outlined and actually detailed in 1940. So it's been around for a while. And in 1942, here in America, a chemist named Roger Evans actually discovered CBD. And naturally, in 1960, when all the research was being done by Dr. Raphael Mechoulam, that's where he was able to isolate the structure of CBD and delta-9. Cannabinoids have been around for a while. Amy, tell me a little bit about what an cannabinoid is in the endocannabinoid system.
Yeah, sure. So like Michael was saying, they are the molecules that stimulate the cannabinoid receptors within the body and brain. The cannabis plant naturally produces over 100 different cannabinoids, including THC and CBD. And our body, which is the endocannabinoid system, naturally produces those molecules as well. Now, the endocannabinoid system does have a lot of input into different processes in our body. So cognitive health, physiological health, pathophysiology processes, our immune system, memory, mood, pain, even psychosis. The endocannabinoid system is just a signaling pathway within our body that has both an internal stimulant, which is our own endocannabinoids, and an external stimulant, which is cannabinoids that we put into our body.
And it's interesting that endocannabinoid system works in concert with our nervous system. And that's been the real breakthrough, is realizing that when your nervous system signals that you have a problem, basically that signal travels up through your spine, goes into your brain and says, Houston, we have a problem. And what we've now found out is that what Houston does, what your brain does, is produce endocannabinoids to be able to then address that particular problem with your body. It's interesting that the way they work is both agonist, antagonist, and inverse agonist. Now, I'm not going to get too technical, but Amy, tell me a little bit about that, because that has a lot to do with how the cannabinoids work with your body and really produce the medical effects.
Certainly. So, like I just said, the endocannabinoid system is a naturally occurring system within our body, and it's part of a signal pathway. So when cannabinoids are interacting with it, they are either activating that receptor, and that can be an agonist, where a chemical that activates the receptor to produce a biological response. It can be an antagonist, which means it blocks the action of that agonist, or it can be an inverse agonist, which causes the opposite of the agonist. I know that's a little bit confusing, but cannabinoids can have different responses to different receptors throughout the body.
Now, there's a lot of cannabinoids that are in science. We have endocannabinoids that are produced by our body. This is how your body manages itself, and we talked a little bit about that. But also, the phytocannabinoids exactly mimic those endocannabinoids. That's kind of an interesting breakthrough, isn't it, Amy?
It really is. So what we're finding out, and what more science is showing us, is that the compounds that are naturally occurring in the cannabis plant are, just like you said, it mimics the compounds that are naturally occurring in our bodies. So when that signal pathway in our body is working, our body, when we're not supplementing it with the cannabis plant, it's using endocannabinoids that we naturally produce to send those signals throughout our body. And then when we introduce cannabinoids from the cannabis plant, those are phytocannabinoids that we are supplementing our own body.
And those cannabinoids are found in what they call the trichomes. That's this little picture over here. So when you see a flower, the actual cannabis flower itself, it's those trichomes that are containing the cannabinoids that are really out there. Now, what's interesting is that, again, I mentioned that this works with your nervous system, but these CB1 and CB2 receptors are something that we have throughout our body, and really the key to making or showing how cannabis can work. Michael, tell me a little bit about CB1 receptors.
So your CB1 receptors are your cannabinoid receptors. They're located in the brain, the spinal cord, and some of your peripheral organs and tissues. These receptors act like gates that open and close to control the levels and activity of most of the other neurotransmitters. And then you have your CB2 receptors, and these are found in your white blood cells, in the tonsils, and in the spleen, and they help to control immune function and inflammation in particular.
And this is kind of interesting because really CB1 receptors really naturally kind of move towards working with the THC cannabinoids, where CB2 receptors naturally tend to move and work with the CBD receptors, although both of those receptors work with THC and CBD. The question is, what's the primary and the secondary? Amy, this has a lot to do with how the endocannabinoid system affects all the different, let's just say, processes in our body, like pain and anxiety, right?
It does. Like, you'll notice that a lot of the CB1 receptors are in the brain and spinal cord, and we find that CB1 receptors have a lot more influence with the THC molecule, and that's why it can produce that psychoactive effect, is because that is the receptor that it's normally attaching itself to, versus the CB2 receptor attaches itself very well to CBD, and those are found more peripherally in the body, and so that's what's really helping with pain, inflammation throughout the body.
Yeah, and reducing that inflammation will reduce the pain. What's really interesting too is that although the CB1 and CB2 receptors are associated with the endocannabinoid system, CBD does address receptors outside of the endocannabinoid system. Amy, tell me a little bit about those, because this affects your blood pressure, your sleep, your body temperature.
Yeah, and so that's kind of one of the neat things about CBD is it's not just connecting to the CB1 and CB2 receptors. This is the ones I'm going to name off really quick are just some of the receptors that it connects to in the body. This is by no means a complete list. So the 5-HT receptor is a serotonin receptor, and that's part of digestive processes, blood flow, and breathing. So really like your core functions. Your A2A receptor is responsible for inflammation, coronary circulation. The VR1 receptor is what helps control body temperature and your pain response. And then the GRP55 receptor helps with regulating your blood pressure.
Yeah, so CBD really works like a super vitamin for your body.
It can, yeah, because it's working on a lot of different receptors and interacting with a lot of different body processes and systems.
So there are a couple of main components when you look at cannabinoids. You have your CBD and THC. These are kind of the two main ones, although there are over 120 being studied and 200 of them that have been found. Michael, tell me a little bit about CBD and THC, if you don't mind.
Well, they're both found in cannabis. CBD is going to be responsible for the non-psychoactive effects. It'll target the CBD2 receptors in the peripheral organs and in your immune system. And then Delta 9, or your THC, this is responsible for the psychoactive effects. And this targets your CB1 receptors in the brain and the central nervous system.
And as we mentioned earlier, CBD is really associated with helping to control and reduce inflammation. And THC is looking at reducing and controlling pain, for example, amongst doing other things. And we'll talk a little bit about each of these components in depth as we go along. But the most common cannabinoids that we see are CBGA, THC, CBD, THCV, CBG, CBGN, and CBC. So let's actually talk about those, because we're going to get into what some of these are. CBGA is really interesting, Amy, because this is the one where when the cannabis plant first starts, when the cannabis starts growing, then CBGA morphs into THCA, CBDA, and CBCA, and then as it's heated and aged, produces all the other cannabinoids we find in the plant itself. That's kind of an interesting process, isn't it?
It really is. So if you think of it, CBGA is like the mother of the other cannabinoids. As that plant is growing and maturing, it is then morphing that CBGA into other cannabinoids, including THCA, CBDA, CBCA, and also into CBG eventually. But it's really cool because it is like the precursor for all of these other cannabinoids.
Sure. It's actually by itself, what you say, the mother of all cannabinoids, but also it has a lot of medical benefits in itself. Tell me a little bit about that.
Yeah, absolutely. So what we've seen is CBG can be really helpful as a pain reliever, great anti-inflammatory properties. It can act as a neuroprotectant against degenerative changes. It can also act as an antibacterial resistant against some bacterial strains. It's been shown to help with psoriasis and other skin conditions, may help regulate emotions like an antidepressant, and it's been shown to help promote neurogenesis,
Sure.
which is the growing of new brain pathways. It may also help fight against colorectal, prostate, and oral cancer.
And what's interesting about CBG is it's not found in high concentrations because remember, it's morphing into other cannabinoids. So typically it's about lower than 1% of the plant itself, but it's still very effective and it's still something to really pay attention to because it can help you quite a bit. It's not the amount, it's the fact that it's there. It's kind of like terpenes are that way. The other side of that is Delta-9, which is the THC product. And Delta-9, gets a rap that it's psychoactive, but in reality, it has a lot of medical value. Tell me a little bit about that, Amy.
Yeah, certainly. So Delta-9 THC, this is the cannabinoid that people usually associate with the cannabis plant because it does have the ability to produce psychoactive effects. So a lot of times when people have a negative view of cannabis, it's because of the psychoactive side effect, which is produced by the Delta-9 cannabinoid. Just like you were saying, though, Delta-9 does have a lot of benefits all on its own. It's a great anti-inflammatory, antioxidant. It's been shown to be neuroprotective, and it's also a bronchodilator. And then it's commonly used to treat symptoms like pain, nausea, and spasticity. And then, like is on there, it has been shown to be very helpful for some specific conditions, including glaucoma, insomnia, PTSD, IBS, convulsions, or other seizure disorders. It can help with weight loss. I'd be a little bit up in the air about that one. And then stress and anxiety. For the weight loss, I always consider that to be THCV is the one that I usually think about with weight loss.
Now, it comes from THCA, and THCA is one of the most medically beneficial cannabinoids in cannabis itself. Tell me a little bit about that.
Yeah, absolutely. When we say precursor to THC or Delta-9 THC, what that means is this is the acidic form of the cannabinoid, and that just means that heat has not been applied to it. So we do know that as cannabis ages or it's heated, it's going to convert that THCA into THC, making it more psychoactive. We do know that there are lots of medical benefits with THCA specifically, including anti-inflammatory. It can help slow the proliferation of cancer cells. It can be an effective neuroprotectant, and it can be beneficial in the treatment of conditions such as MS, Alzheimer's, and Parkinson's. And then it can help stimulate the appetite of patients that are suffering with cachexia or anorexia nervosa. So that'd be people who may not have the desire to eat or have an altered eating pattern. It can help them with promoting hunger to hopefully get them to eat more.
Now, you'd mentioned THCV earlier. Tell me a little bit about that. It really is very important.
It is. So this is one of the minor cannabinoids. That means that it doesn't show up in large quantities naturally in the cannabis plant. It doesn't have the same effects, though, as THC. So side effects, it can help reduce anxiety attacks. It can help suppress hunger. So that's what I was talking about. It can help with weight loss. Now, it has also been shown to enhance bone growth. And then THCV interacts with the non-cannabinoid receptors 5-HT1A, which is part of your system that is dealing with anxiety, depression. And when you're using THCV with some psychotropic medications, antidepressants, anxiety medications, THCV can actually make those medications not more potent, but just more effective. And then it has been shown to bond with the TRPV2 receptor, which is an analgesic receptor. It's also responsible for inflammation and anti-cancer properties as well. It has been found to help with conditions such as epilepsy or seizure disorders by producing like anticonvulsant effects.
Let's jump on to the next cannabinoid, which is CBD. Very famous cannabinoid, one of the top two. But really one of the most important that's really out there. And actually, CBD can be found in both hemp and also marijuana. Amy, tell me a little bit about this one, because this is one of the main components.
CBD would be considered a major cannabinoid because it usually naturally occurs in larger percentages in the cannabis or the hemp plant. Just like you said, both of those plants produce CBD. The cool thing about CBD, just like we said before, it does connect with a lot of different receptors in the body, but the most common one is going to be the CB1 and the CB2 receptors. We do know that there are some potential effects from CBD, such as being pain relieving properties, anti-inflammatory, anti-seizure properties, anti-anxiety, and anti-tumor. And then it has been shown to significantly improve spasticity associated with multiple sclerosis, which can be super helpful, especially if a patient is having a flare. It has been shown to have some benefit in helping treat opioid addiction, may improve insulin sensitivity and type 2 diabetes, the management of ALS or Lou Gehrig's disease symptoms, and then it can be beneficial to help the effects of Alzheimer's, Parkinson's, MS, and schizophrenia.
I mean, CBD is very important for, some very, let's just say some conditions that can really affect your lifestyle. And it's one that really can be found in a lot of different places. One of the other components that come into place is called CBN. And this is, again, one that's really helped a lot. People associate this with sleep, but it also does a lot of other things as well. Tell me a little bit about that.
Yeah, certainly. So CBN is a minor cannabinoid as well, and it generally doesn't naturally occur in large percentages in the cannabis plant. However, when isolated, it can have some really, really helpful properties. On its own, it is mildly psychoactive, but nowhere near the level of THC. And, it's been found to help with, just like you said, help with sleep. It produces that heavy body feeling, which is really great for either relaxing or for going to sleep. It has been found to have some antibacterial properties, is an appetite stimulant, just like a lot of cannabinoids are. It helps delay the onset of ALS and other neurodegenerative conditions. It's been shown to be helpful in the progression of glaucoma. It's an anti-inflammatory, and it can help promote bone growth.
One of the other less known but very important cannabinoids is CBC. And it by itself doesn't produce any psychotropic effects, but it can intensify the THC. Tell me a little bit about this, because it helps with a lot of different conditions.
Yep, it does. So it is a powerful antibiotic on its own and has been shown to have some benefit against treatment-resistant infections. It may help protect the brain from neurodegenerative conditions like Alzheimer's, and it's been shown to promote neurogenesis, which is the regrowing of new brain cells. CBC does not have a high affinity for binding to either the CB1 or CB2 receptors, but it does act on the TRPV receptor to break down endocannabinoids, which the 2-AG is actually that's getting a little bit into the more dense stuff. But so the 2-AG, when your body breaks down THC, it actually converts it to 2-AG, and CBC is helpful in clearing that out of your body. Definitely like a regulator of the endocannabinoid system.
And it can help a lot with a lot of different conditions that are out there. Again, it's not widely known, but it's very effective. Now, what's interesting is all of these cannabinoids are very heat sensitive. In other words, what you've got to be is very careful. Now, when you're using medical cannabis as a tincture or as a topical or as an edible, you really don't have to worry too much about that. But if you're taking it and you want to use it to vape or to use it to roll it up as a joint and a blunt, this could be a problem. And the reason for that is that, or not a problem, it's something that you do have to manage. Because if you take that joint, you take that blunt, and then you take that 550-degree temperature and you go light the end of the blunt, what you're doing is you're burning off, as you can see from these temperature settings here, you're burning off most of the cannabinoids, almost all the terpenes, and almost all the flavonoids. So a joint really loses about 60% of its medical efficacy. That's the bad news. The good news is it works. You just got to smoke more of it in order to get the medical benefits that you need. Now, if you want to take a look at using flower effectively, put it in a dry herb vaporizer, which is a device that you take that flower, you drop it into a little canister, and then that actually heats up or steams the flower, and it gives you the capability to be able to smoke it, but also be able to set the temperature and be able to control which cannabinoid profile and terpene profile you want. And that's actually true of using a vape pen itself. The actual pen itself will really help you quite a bit. Amy, tell me a little bit about vape pens and dry herb vaporizers and the heat settings. This is a really important chart.
Yeah, especially with a dry herb vape, it can be really helpful to have that heat regulation because that's not only going to change how it feels to actually inhale that vapor, it's going to change the actual medical efficacy of it. Because just like you said, at higher temperatures, we are burning off and losing the efficacy of a lot of those cannabinoids, flavonoids, and terpenes. And so when we can regulate it to a lower temperature, you're actually getting the most medical benefits out of the product. A lot of times with vapes, especially, if a patient does buy a battery that doesn't have temperature control, they're really missing out on the ability to be able to regulate it to better meet their needs. So I really like to recommend batteries that have more temperature control to patients, and it just gives them the ability to get different effects out of the same product.
Like Michael, you have at Air, you have vape pens that you can buy, in fact, are fairly inexpensive, that have a low, medium, and high setting on there, like a blue, green, or red. Tell me a little bit about this.
Yes, Mark, this is correct. At Air, we do sell a variety of batteries that have the 3 heat settings. In fact, all of our batteries and dry herb vaporizers have those. We have tools. If you're somebody who likes concentrates, they can do the same thing. A lot of patients don't know about this, and they automatically think getting the hottest setting and getting the most THC is giving them the most benefit. But as both of you said, it's burning off a lot of the cannabinoids and terpenes needed, and that'll be more beneficial than the THC.
Yeah, I just have to point out, when I have a dry herb vaporizer that I use, and I set the temperature at 356 degrees because what that does is that brings out the best terpene profile and cannabinoids that I'm looking for because I'm trying to manage inflammation. This is an important chart. And again, go in and ask your dispensary for a vape pen or have them show you how your vape pen can be set to those temperature range because it'll allow you to really tune in the terpene profile and the cannabinoids to address your particular condition. Now, we've covered a lot of topics today, and from what cannabinoids are, what they do, and what the individual cannabinoids can do. Let's wrap up a little bit, and let's start, Michael. Tell me a little bit about Air, because you have some final words that you want to add to the cannabinoids, including the fact that you have a rather broad range of products that can really address the terpene profiles that we're looking for.
Yes, Mark, we have a wide variety of products, whether it be edibles, tinctures, we carry balms. We also, of course, have flour, your pre-rolls. We carry a lot of one-to-one CBD, THC products. We carry RSO capsules, which are very beneficial for pain. We also give we give everyone 50% off new patient visit discounts. We also offer loyalty programs. We offer discounts for your veterans, your pediatric patients, and seniors. So we have a lot of incentives and for you to come experience and see what all we have to offer.
Yeah, I think it's important to point out, this webinar is not just to give you the theory and the information. You might then say, well, where can I go to get a product that can address my condition? And I think Air is one of those particular dispensaries that you may want to take a look at because it has the quality, the number of locations, and of course, the distribution that you're really looking for, as well as, Michael, you can ask the bud tenders for assistance, right?
Correct, Mark. All of our bud tenders are very helpful. They go the extra mile for you guys. If you're really wanting to dial in on your terpenes and the percentages of those, I encourage you to ask them. They can look up this information at the counter for you. When you're shopping online, right underneath the product, you can access that.
And it's important to find a dispensary that has the terpene profiles and the COAs, and I think Air is really good to do that. So, Michael, thank you very much for your comments today and for participating. Amy, you work with the medical marijuana treatment clinics of Florida, and one of the reasons I like working with y'all is because you have 22 locations. You help your patients through the actual patient journey. But tell me a little bit about this, because you actually are there to support the customers, not just give them a card, but to support them with their cannabis journey.
Absolutely. So a lot of times we do have patients that come in and, they may have used cannabis back in college and they've not thought about it since. So getting them up to date on the products that are available to them the different routes that they can utilize, because a lot of people honestly don't want to smoke or inhale anything. And so just letting them know all of the different products that they can use that meets their needs while avoiding smokable or inhaled products can be really helpful. And then a big part of my job is helping patients create a plan or start to create a plan that's hopefully going to work for them. So one thing that I will always recommend is using a patient treatment journal. That's just to help you keep track of what's effective or ineffective, quite honestly.
And people can get that patient journal by going to one of your clinics to be able to get this, or go online to mmtcfl.com and be able to download the patient information brochure.
That is correct. Yeah, we want to make sure that patients have free access to that. It's just a tool for them to use. They can make copies of it. We just want to make sure that they feel as prepared as possible starting this journey.
Well, Amy, thank you very much for your comments and your sage advice. We really appreciate that. I do want to point out, if someone's looking for just a cannabis practitioner to help you, the Blunt Joint is here to be able to help you. Manny Alfinas is normally helping me with this, so please feel free to consult him if you're looking for help in general and advice and someone to talk to. And naturally, I want to promote Marijuana Aware channel, which this video will be on, as well as other videos to help you with your cannabis journey, as well as Marijuana Aware, where you can actually register for these webinars coming up. We have 2 more left this particular quarter: personalizing your cannabis treatment, which we'll be doing on May 21st. And then on June 4th, we're going to be talking about cannabis use disorder. So I thank you all for joining me, and I thank you all for watching this. I hope that if just one person has watched this and they get their life back, we've accomplished what we wanted to accomplish. So thank you very much, and we look forward to having you join us for the personalized cannabis treatment video coming up. Thank you.